After the age of 60, your body does not send the same clear signals it once did. In your younger years, illness often came with obvious symptoms. Pain was sharper, fever was higher, fatigue was dramatic. But later in life, disease can develop quietly, without warning signs that force you to act. That is why medical screening becomes more important, not less, as you grow older. My name is Dr. Joseph Butler, and for decades I have worked with men and women who believed they were healthy simply because they did not feel sick. What they did not realize is that some of the most dangerous conditions in older adults begin silently. Today, I want to talk to you about 3 medical exams that should never be skipped after the age of 60. These are not exotic tests. They are not experimental. They are not meant to frighten you. They are meant to protect you. They help detect disease early, when treatment is simpler, safer, and more effective. Skipping them does not mean you are saving time or money. It means you are giving illness more time to grow unnoticed. The first exam I want to discuss is blood testing focused on metabolic and organ health. Many people think of blood tests as routine or unimportant, but in reality, your blood tells the story of nearly every system in your body. After 60, metabolism changes. Muscles use glucose less efficiently. The liver processes fats differently. The kidneys filter waste more slowly. Hormones that regulate appetite and energy shift. This means that conditions like diabetes, high cholesterol, anemia, kidney disease, and liver dysfunction become more common and more dangerous. A simple fasting blood test can reveal whether your blood sugar is creeping into the diabetic range long before symptoms appear. Scientific research shows that type 2 diabetes often develops silently for years before diagnosis. During that time, high blood sugar damages nerves, blood vessels, eyes, and kidneys. By the time symptoms appear, much of that damage is already done. Early detection allows lifestyle changes and medication to prevent or slow these complications. Cholesterol and triglyceride levels are another critical part of blood testing. As arteries age, they lose elasticity and become more vulnerable to plaque buildup. High LDL cholesterol and elevated triglycerides increase the risk of heart attack and stroke. Large population studies consistently show that managing cholesterol reduces cardiovascular events, especially in older adults. Yet many people do not know their numbers. They assume that if they feel fine, their heart is fine. This is a dangerous assumption. Blood tests also reveal anemia, which is common in older adults and often overlooked. Anemia reduces oxygen delivery to tissues, causing weakness, fatigue, dizziness, and poor exercise tolerance. It may result from nutritional deficiencies, chronic inflammation, kidney disease, or hidden bleeding. Without testing, anemia is often blamed on old age instead of treated properly. Kidney and liver function tests are equally important. The kidneys regulate fluid, electrolytes, and waste removal. The liver processes medications and toxins. With age, both organs become more vulnerable to stress from dehydration, infection, and medication side effects. Many people only discover kidney or liver problems when symptoms become severe. Routine blood tests allow early detection and medication adjustment before permanent damage occurs. The second exam you should never skip after 60 is cardiovascular evaluation, especially blood pressure measurement and heart assessment. Heart disease remains the leading cause of death in older adults worldwide, yet it often progresses without pain. High blood pressure is called the silent killer because it damages arteries, heart muscle, kidneys, and brain without causing symptoms for years. Regular blood pressure measurement is one of the simplest and most powerful tools in medicine. Scientific evidence shows that controlling blood pressure reduces the risk of stroke, heart attack, heart failure, and cognitive decline. After 60, arteries stiffen naturally. making blood pressure harder to control. This means that even people who had normal readings in midlife may develop hypertension later. Beyond blood pressure, heart rhythm and heart function also deserve attention. A simple electrocardiogram can detect rhythm abnormalities such as atrial fibrillation, which greatly increases stroke risk. Many people with atrial fibrillation feel no symptoms at all. They do not feel palpitations. They do not feel chest pain. They only discover the condition after a stroke occurs. Detecting it early allows treatment that reduces stroke risk dramatically. For individuals with risk factors such as diabetes, smoking history, family history of heart disease, or persistent shortness of breath, further heart evaluation may be recommended. This can include stress testing or imaging. The goal is not to turn everyone into a cardiac patient. The goal is to identify silent disease before it becomes catastrophic. The third exam you should never skip after 60 is cancer screening appropriate for your age and sex. Cancer risk rises significantly with age because DNA repair becomes less efficient and exposure to environmental damage accumulates over time. Many cancers grow quietly at first. When they are finally discovered because of pain or weight loss, treatment is more difficult, and outcomes are worse. Colon cancer is one of the most preventable cancers when detected early. Colonoscopy or other stool-based screening tests can identify precancerous polyps before they turn into cancer. Research has shown that colon cancer screening reduces mortality significantly, yet many adults avoid it out of fear or discomfort. In reality, the exam is far safer than untreated colon cancer. Breast cancer screening remains important for women after 60. Mammography can detect tumors long before they can be felt by hand. Prostate cancer screening is more complex and should be discussed individually with a physician, but ignoring it entirely is not wise. Lung cancer screening with low-dose CT scans is recommended for older adults with a history of smoking because it detects tumors early enough for curative treatment. Skin cancer screening should also be considered, especially in individuals with fair skin or long sun exposure. Melanoma and other skin cancers are much more treatable when caught early. These three exam categories, blood tests, cardiovascular evaluation, and cancer screening, are not about finding disease. They are about finding risk. They allow you to intervene when your body is still strong enough to respond. Now, let's talk about why these exams matter more after 60 than at any other stage of life. Aging reduces physiological reserve. This means that when illness strikes, recovery is slower and complications are more likely. A mild infection can become pneumonia. A small stroke can become major disability. A brief period of dehydration can trigger kidney failure. Early detection reduces the severity of these events. Another reason is medication interaction. Many older adults take multiple medications. These drugs affect blood pressure, blood sugar, kidney function, and liver metabolism. Without regular monitoring, side effects accumulate silently. A blood test or blood pressure check may reveal that a medication dose needs adjustment before harm occurs. There is also the issue of lifestyle change. After retirement, daily routines often shift. Physical activity may decrease. Eating patterns may change. Sleep schedules become irregular. These changes influence metabolism, cardiovascular health, and immune function. Exams provide feedback on how your lifestyle is affecting your body, not how you think it is affecting your body. Many people avoid exams because they fear bad news. But avoiding information does not prevent disease. It only delays treatment. I tell my patients this: knowing gives you choices. Not knowing takes them away. Prevention is not about living in fear. It is about living with awareness. It is about giving yourself the best chance to remain independent, mobile, and mentally clear. I have seen patients who discovered diabetes early and prevented kidney failure. I have seen patients who discovered atrial fibrillation before a stroke occurred. I have seen patients who had polyps removed before cancer developed. These outcomes were not miracles. They were the result of simple exams done on time. The purpose of this message is not to overwhelm you with medical details. It is to simplify your priorities. After 60, do not skip blood tests that show how your organs and metabolism are functioning. Do not skip heart and blood pressure checks that protect your brain and circulation. Do not skip cancer screenings that can detect disease before it spreads. These exams do not guarantee perfect health, but they greatly improve your odds. Now, I want to speak directly to you. If you feel well, that is wonderful. But feeling well does not mean nothing is changing. Think of your body like a house. You do not wait for the roof to collapse before checking for leaks. You do not wait for wiring to spark before inspecting it. Maintenance preserves what you already have. This is the mindset of healthy aging. It is not about reacting to illness. It is about anticipating it. You have worked your whole life for your independence. These exams help protect it. And remember something important. Medicine works best when it is proactive. Once disease becomes advanced, treatment becomes harder, more expensive, and more invasive. Early care is gentler and more effective. If you are over 60 and you have not had these exams recently, do not feel ashamed. Feel informed. Make a plan. Talk to your doctor. Ask what screenings are appropriate for you. Not every test is for every person, but everyone needs monitoring. Your body deserves attention now more than ever. Before we finish, I want to leave you with this thought. Aging is not a loss of value. It is a change in strategy. You move from speed to wisdom, from reaction to prevention, from ignoring signals to listening to them. If this message helped you, I invite you to join our community. You can subscribe to this channel for free using the link below and learn how to protect your health with clear, medically grounded guidance designed for adults over 60. If you found this video useful, please like it and share it with someone who may need this information. Your support helps us reach more people who want to age with strength, clarity, and dignity. I look forward to seeing you in our next video.
Join us on Healthcare Seniors.
Be part of our community and watch the next video.